Hi, my name is Adedaja Aofolajuwolo, and I will be bringing you information about chromic acid in clinical settings, a public health preparedness trainer. So, what is chromic acid? Chromic acid is also known as H2CrO4 or chromium 6. Chromic acid is a highly toxic compound. It is a powerful oxidizing agent and it is corrosive. Chromic acid is the mixture of chromium trioxide and sulfuric acid. It is used in laboratories that clear or clean glasswares and prepare laboratory glasswares. It is also used for metal etching and chromium plating. Some facilities also use it in medicine. So, chromic acid is highly um, damaging to the human body. It can be ingested, so from hands to mouth or through contaminated foods and drinks. It could be inhaled through contaminated air, and if we have skin contact with it, it could damage our organs and skins. A minimal level exposure to chromic acid could still be damaging, and those damages could be irreversible. Who's at risk? Lab technicians, custodial workers, and handlers of treated surfaces. This would include people that mix it in labs, people that clean up after the day's job, or even people that package the glasswares that have been processed using chromic acid. Other people might also include people with respiratory illnesses, pregnant women, and not just to themselves, but to the fetus or fetuses within their womb and to small children. The take home for who is at risk is basically anyone and everyone in proximity to chromic acid could be at risk of this contaminant. So, why is this information important? Why should we disseminate this information? Because chromic acid is a known human carcinogen. So, when in contact with us, human beings, it causes cancer. It could also expose us to the risk of skin burns, lung damages, and organ failure. So, if we expose ourselves enough to this acid, it could cause our organs to fail. Chromic acid is regulated by OSHA. It is under the column of excellent chromium standard, and any lab technicians or facility in a non-compliant state with the protocol set out by the federal and local regulators could be imposing legal penalties on themselves. Where and when are we at the most risk? We are at most risk in the labs where chromic acid is being made or being used either for medicine, metal etching, chromium plating, or glassware cleaning. Labs are the primary location for risk. Also, during packaging, for those that handle the packages that chromium acid was used on, could also be at risk of this chemical. And finally, wherever there's fume or spillage or in poorly ventilated spaces where chromic acid has been used, those spaces could also pose risk to whoever is there. So, how do we protect ourselves? We protect ourselves by first wearing our PPE. This includes goggles, glasses, lab coats to protect our outer clothing, face shield to protect our skin from being exposed, and working in a fume hood only. When we work in fume hoods, the hoods are designed to excavate the fumes out of the lab so that we do not inhale those toxic fumes into our nostrils. And finally, we need to be following strict disposal protocols when handling this chemical. Chromic acid should never be poured down a regular drain as it can contaminate the waterways and affect more people down the line. We should be neutralizing chromic acid whenever we use it in the labs with sodium bisulfate. We should also be rinsing any glassware that has been processed with chromic acid thoroughly before we use them or before we even handle them with our bare hands. And finally, we should only work in well ventilated spaces when handling this gas. Final consideration, if there has been any exposure, we need to report immediately and we need to continue our hazmat training on a yearly basis. Thank you.